I'm Dr. Grant from Brunswick Veterinary Hospital, and our clients sometimes have questions about lab work or when your veterinarian might order lab work for your cat. We've written down some questions, and my assistant Adri is going to help me out by reading them off today. Adri.
Okay. What is a baseline lab test and why is it important?
So a baseline lab test is basically getting a lab test on a patient when they're healthy so that we kind of have something to compare to in incidences when they're sick. Or in cases that have an ongoing progressive known illness, letting us know where that patient is at that point in time. In case they come back in the future with progressive or other illnesses, we can compare current blood work to what has been done previously as a baseline test to say, is this progression or is this expected for this patient, or is there something new or more concerning going on?
What other times will my veterinarian order lab work for my cat?
So other times your veterinarian might order some lab work for your cat is if they have any concerns for some underlying illness. A lot of times when we do a full nose to tail physical exam, we might not find something we might find something that was not noticed before. Whether there's any signs of muscle loss or signs of illness that might indicate, this is something that I want to investigate a little bit further. Let's order some general comprehensive lab work to see what may be going on with different body systems or with this particular patient.
Okay. Can blood work provide a diagnosis for my cat?
So blood work can sometimes provide a solid diagnosis. That being said, sometimes blood work might not tell us exactly what is going on, but can start directing us towards where the problem is, what organ is the problem associated with, and helping gear future diagnostic tests until we get to an answer.
Do blood tests detect cat cancer?
So unfortunately, there's no one particular test that does test for cancer. However, there are some indicators that we can see on blood work that might indicate, cancer might be a concern in this particular patient. As always, we do compare our baseline lab tests to the current clinical signs and current physical exam of the patient. And sometimes what we see on our baseline or our general minimum database lab work might kind of suggest that there may be cancer here.
How effective are lab tests in cats?
So I find lab tests in cats to be very effective, particularly because they're very stoic animals and they often don't show obvious outward signs of illness when they're not feeling well. This is why it's so important for us to do routine lab work on these guys for early detection of disease, because they might not outwardly show us that they're suffering from an illness, but there might actually be something ongoing or chronic happening with them.
What type of lab tests do veterinarians use?
So our common lab test that we do for these guys kind of falls under the umbrella of the minimum database, which includes a complete blood count, or a CBC, which looks at our different white blood cell levels as well as our red blood cell levels to evaluate for any inflammation or infection, or even things like anemia. Our second test that we'll frequently do is called a chemistry panel. Chemistry panel will look at liver, kidney, overall organ function, in addition to electrolytes and blood sugar, to give us an overall idea of how the body is doing. We will often do a urinalysis as well to kind of compare not only to the kidney values that we see on the chemistry panel, but also to evaluate if there's any inappropriate proteins or inability of difficulty concentrating urine. Having all of these together kind of gives us a general broad, what is going on with this patient, how did everything fit together, and is there anything ongoing that we need to be concerned about?
What lab tests are the most accurate and why?
So, as far as lab tests that are the most accurate, it really depends on what we're specifically looking for. I will say that your general minimum database, so your CBC, your chemistry panel, and your urinalysis are a good first step at directing where we need to go. Depending on what we see with lab work, or if there's not really much on that lab work, we might direct ourselves over to diagnostic imaging, such as an ultrasound or a radiograph, versus if we're going to be doing some more in-depth and specific tests. It really depends on the test that we're doing and what we're looking for, but your minimum database is a good starting point for most diseases.
How does my veterinarian decide which lab tests to order for my cat?
So it really depends on what we're seeing with our clinical picture. Depending on what is happening with that animal, we might want to prioritize certain lab work over others or add certain lab work on top of it. A good example would be with hyperthyroidism in cats. A lot of times your chemistry panel and your CBC might not include a thyroid panel, but if we're concerned that a patient might have hyperthyroidism, then we'll add an additional test to look at their thyroid levels to evaluate what's happening there.
Well, thank you for going over when a veterinarian might recommend blood work for my cat.
Absolutely. Let me know if you have any more questions.